And obviously with the practical now, we're going to look at spontaneous nystagmus. Spontaneous refers to the patient just looking straight ahead. And a gaze-evoked nystagmus is when the patient is now looking in different directions and we're seeing if the nystagmus changes direction or beats faster in one side or the other. Okay, so let me demonstrate that. So the first thing we want to do is look for what we call spontaneous nystagmus. So the first thing is we don't need to use any technology as such. Nice to have something that can video record it. If you want to use a phone to video record their eyes, fantastic. Observation should be sufficient at this point. So we're asking the patient to look straight ahead. James, can I get you to look, on the other side of the room? Okay. And what we're doing with James is I'm picking one eye. You don't need to look at both eyes. As long as the eyes are conjugated, right, for most of us, unless they've got some disconjugated gaze condition like MS, typically you look at one eye, you're looking at both eyes, okay? So the patient's asked to look straight ahead, and we're just observing here to see if there's any spontaneous nystagmus. So we're looking to see if there's any horizontal nystagmus, and if so, in which direction, if there's any vertical nystagmus or any torsion. Now, with observing torsion and nystagmus at this point of view, the best way to do it is, understand you've got a round pupil. Seeing something round turn on itself can be quite difficult. All right, so what I would suggest to do is look for blood vessels that normally emanate from the pupil themselves. And if you see a blood vessel doing this, you know there's some torsion component to it. Okay, if you need to, certainly don't be shy to get in there, peer the pupil up so you get a good look at the pupil in doing that as well. Okay, so for a low-tech, no-tech perspective, this is a great way to do it. So in this instance, we're doing spontaneous nystagmus, patient's looking straight ahead, and we're looking to see if in daylight we're seeing it. Remember, if we can see it at this point and it's under 2 days, it can certainly be a central disorder, but also can be an acute peripheral disorder. If we're exceeding 3 days, maybe a week, and we can see it in daylight, and there's now a bit of verticality to the nystagmus, we're thinking there's something a bit more central at play. Okay, we're not thinking peripheral because it should have habituated, and we shouldn't have seen it more. We should have seen a more horizontal plane. If we're looking at this and going, James, I don't see any nystagmus, I'm still not convinced that there's not one there, because obviously now James can focus on something in front, so his brain's suppressing that nystagmus. So in this instance, sorry James, I'm going to ruin your hair, buddy. All right. If I shine a light in James' eye, you can see it there on the camera quite nicely. Now, James, can you focus on anything? Can you see anything with clarity?